Well, there's a solution for hair loss that can make your hair look thicker and fuller. Joining us today is expert technician and owner of Scalp in Connecticut, Debbie Barton, along with Dr. Ivan Cohen, to tell us about some of the treatment options. Welcome back, Debbie. Nice to have you here, doctor.
Thank you.
Let's talk about the hair transplant procedure, because I understand it's come a long way from what it used to be.
That's absolutely true. First transplants were done about 50 years ago.
50
years ago, and since then it's evolved into a highly technical, sophisticated technique where the results are undetectable.
Oh, that's incredible.
So about 6 years ago, I was the first surgeon in New England to perform a robotic hair transplant.
Okay.
And that technique is even more advanced than anything we have done before, where we can remove individual follicles from the back of the head and place them in the areas of thinning and balding.
Wow. Is there a good patient for this? Do you have to be a certain type of balding, or does it not matter?
So generally we deal with men and women with pattern baldness, where in a man there's a fringe around the, there's actually a picture of that, of a patient that I've done. And the hair on the back and sides of the head are programmed to grow for a lifetime.
You're not going to lose that most likely.
So once we take that hair and move it to the bald areas, it continues to grow. It's really a permanent solution. So
I mean, look at the before and after there. That's incredible.
If we look at that gentleman, you can see he has hair on the sides of his head. He will never lose that hair. So when we move that hair, so we did about 2,000 grafts on him, which means we moved 2,000 hairs and groups of hairs, which look totally natural. And that hair is permanent. So
that looks great. We have one more picture, too, another example.
This is another gentleman, you know, also had about 2,000 hairs and looks completely natural. So a transplant today is completely undetectable. If you can tell that somebody had a hair transplant, it wasn't done right.
Okay. But the problem is you can only take so much hair, right?
So that is the problem, and that's why Debbie and I have been collaborating, because there's only a finite amount of donor hair.
Sure.
And once you use that up, there's no more hair. So on one of those patients, you can see I covered the front. He was bald.
Right.
I covered the front, I covered the top, but he doesn't have enough hair to do the back. So if he wants to do the back, we need to do something else.
And Debbie, so that's where you come in, right?
That's where Debbie's Scalp MicroPigmentation comes in.
A client that we had worked on, it was a female client. I believe she had scarring alopecia.
Right, yeah. She had for years a scarring inflammatory disease of the scalp that destroyed her hair follicles. And once it calms down, you can do a transplant. So I transplanted as much as I could, and I think we have a picture of that there.
Take a look.
And then Debbie and I talked about it, and
this was prior.
So that's what she looked like before, and then that's.
I mean, that's a huge difference, though.
That's what I was able to do, to get her to that point, and then Debbie, you can.
Debbie, is it like a tattoo, or how does it work?
Yeah, my work is a tattoo, a scalp micropigmentation. Okay. So what happened is that she had her transplant, and then she wanted a second, but she didn't have enough donor hair to add thickness. So then this picture here is me adding my dots to it. So
yeah, look how good that looks. It looks fabulous, right?
It's a great combination, the transplant.
So it really enhances the result of a transplant.
Yeah, and it also builds
totally natural
confidence back.
Oh, absolutely. Actually, she gave me this little bracelet.
So
Thank you, honey.
Right?
And she goes, "I'm so thankful for you."
That's great.
Yeah, thankful for Dr. Cohen, and then for him to send him, for Dr. Cohen to send the patient to me.
So what is the first step if someone at home would like to go for the transplant and then maybe follow up with Debbie?
Yeah, well, you know, so the first step would be to come and see if they're a candidate for a hair transplant. I mean, if they have so much hair loss, they might not be a candidate. And then she could, you know, if they wear their hair short, they could look like they have a full head of hair with her technique.
Right.
You know, and if they are a candidate for hair transplantation, most patients, that's all they need.
Well, now you know. If the baldness bothers you or thinning hair, there are lots of options.
There are lots of options.
Yes.
Very good. Well, thank you both for being here today. And, of course, you can check out scalpinct.com.